first step is to prepare the Alidya vial that we are to use for the patient. So Alidya comes, as you know already, in two separate vials. One is the powder, where all the active ingredients are actually included, and then this is a 10 ml vial of just water for injection to dissolve the powder. Okay, so before the treatment, and only when the patient is already in the clinic, is when you reconstitute these two things, because once this is achieved, you only have roughly 20 minutes to actually deliver the treatment. This is done this way, so all the properties of the ingredients that constitute Alidya are preserved the best way to achieve the best results. So the first step obviously is just to open the vial, and using a 10 ml syringe and a big needle just to draw the contents. So you just draw your 10 ml of the water for injection. Make sure that you have your 10 ml in your syringe. There's a bit left here. Okay, good. Putting a bit of extra air in your syringe will help to introduce the water for injection into the vial. You take the red cap off, and then you inject the content. You're gonna feel some pressure, but I use actually on my advantage to start mixing the contents inside the vial. And at a certain point, you need to release it and then put it back again. It is very important to make sure that I mix the powder really well, because the goal is to achieve a clear solution. Like in this case, there's still a bit of powder in the bottom, so I need to keep shaking the vial. And if it's not clear, you haven't done a great job and you're not supposed to use the vial, okay? So it's getting better, still a little bit there, so I keep going. And now you have a clear solution with no remains of any powder. Now Alidya is ready to be used. Once we have the clear solution within the vial, all we have to do is draw the contents back into our 10 ml syringe. And sometimes what I do, in order to make sure that I can get the full content, I put these horizontally until I can make sure that all the contents of the vial have been totally put into my syringe. So now the vial is empty, all the contents are in this syringe. I will switch this needle, which obviously I will not be using on our patient, and I will use, in this case, this 30 gauge 13 millimeter needle, the yellow needle that most of us have in our clinic. And now I'm ready to go.